Hello, I'm Dr. Hilary Jones. I'm a GP and medical broadcaster. Some of you may have seen me crop up on breakfast television over the years talking about a whole range of different medical conditions. But right now, I want to talk to you about the importance of smear testing. Pall Mall Medical and I have joined up, and I'm going to answer some of those frequently asked questions about smear tests. First of all, what is a smear test? Well, a smear test or cervical screening takes a few cells from the surface of the neck of your womb, the cervix, and it's a screening test to prevent cancer, not to detect existing cancer. And it's really important to make sure that any changes are picked up at the earliest possible opportunity so that future cancer can be prevented. Why do some women opt for a private smear test? Well, on the NHS, you'll be invited for a smear test up to 6 months before you're 25. From 25 to 49, you'll be invited every 3 years under the NHS screening campaign scheme. And from 50 to 64, every 5 years. And if you're 65 or older, you'll only be invited if one of your previous 3 tests were abnormal. Pall Mall clinics offer the test from 18 years of age, and you can be screened as often as is necessary. Why are HPV tests now being carried out as part of the screening process? Well, Pall Mall supports the new NHS guidelines showing that primary HPV tests can also lead to more precancerous lesions being detected. They can be found earlier, in other words, so that gives women extra reassurance that all is well. How often should you have a smear test? Well, Pall Mall offer smear tests from the age of 18 upwards, and you can be screened as often as is necessary after that. You don't need an NHS referral. You can simply call and make that booking without any waiting list at your convenience. Is a smear test painful? A smear test is slightly uncomfortable, but it shouldn't be painful. It can feel a little bit strange, but the very experienced nurse that's looking after you should well be able to handle any concerns that you may have and put you at your ease. And the more relaxed you are, the more comfortable it's likely to be. Is there anything you should do before having a smear test? Well, I think it's important to avoid sexual intercourse, avoid any douching, any vaginal moisturizers, spermicidals, or jellies, creams and pessaries for at least 2 days before having the pap smear. This just makes sure that the cells we want to detect are not washed away and diluted so that the test becomes less reliable. Try not to schedule your smear test either when you're having your period. How long does it take to get your smear results back? Well, at Pall Mall Medical, you'll get your results back within about 3 to 4 days, which is much quicker than the national average of 2 weeks. How much does a private smear test cost? At Pall Mall Medical, with a nurse, it's £120. Why is it so important for women to have smear tests? In recent years, the uptake of offers for smear testing has actually diminished, and that's of great concern because cervical cancer is still one of the major types of cancer that we see in women. But it's entirely preventable. A smear test takes a few moments. It's not painful. It might be slightly uncomfortable, but those few minutes can actually save your life. And I would say to every woman who's offered a test or who wants to have a test, any woman who's sexually active, even if she's been vaccinated in the past, please get your smear test. It saves lives.